Hello, this presentation will be on central nervous system stimulants and attention deficit disorder medications. Central nervous system stimulants and attention deficit disorder are treated by amphetamines and dextroamphetamines, methylphenidate and dexamethylphenidates, methylxanthines, and miscellaneous other stimulants. Amphetamines. Therapeutic uses include ADHD and narcolepsy. Those would be what you would be treating with amphetamines. And of course, you have your illegal stimulants, amphetamines such as speed and meth. So, for the amphetamines, for your dextroamphetamine sulfates, you have immediate release formulations which you would give once a day up to 3 times a day, and that's usually every 4 to 6 hours. Um, those medications would include uh, Dexedrine and Zinzindi. Also, Procentra. Procentra is a liquid formulation. Usually, these immediate formulations of the dextroamphetamines um, are used for children as young as 3 years old. So these um, that I just mentioned can be given to children ages 3 to 5. Um, at that age, you do not want to give an extended release. They are not approved, and you usually end up giving them several times a day. One advantage to that is that you can give doses when the children seem to need them. So if they need it in the morning and maybe in the afternoon, but in the evening they're okay, then you don't have to give that evening dose because, again, it's up to 3 times a day. For the extended release formulations, you have that would be indicated for 6 years and up. Those are normally given once a day, at most twice a day. So that would be a every 6 to 8 hour dosing schedule. Medications included there would include your Azenis, which is a suspension, and your Dianaval XR. Um, you probably won't, you may not see a lot of these um, formulations used extensively. Some, it depends on the coverage. Um, you may see some of the suspensions because, of course, for younger children, sometimes it's hard for them to swallow a pill. Even though if it's a capsule form, most of the capsules allow you to sprinkle the pellets onto yogurt or applesauce so that the child can take it. But in recent years, they have come out with more liquid formulations. With the amphetamine, dextroamphetamine mixtures, these are the ones you've probably heard more about. So your immediate release would be your Adderall, um, and then your extended release would be your Adderall XR, and there's a Mideas, which is a newer formulation. So those are commonly used. We typically will try to give that school age child the extended release now so that they don't have to take medication at school. I remember years ago we had to give children, they had to all come to the nurse's office at lunchtime to get their midday dose. So with the um, formulations for extended release, this has now really cut back on having to have children go to the office to get doses at lunchtime. It is, of course, still necessary because some children, even if they're taking the extended release, they may need a boost for the afternoon, especially sometimes the older children, because it all depends on what subjects are in the afternoon, if their dose is starting to wear down. they've had the first dose maybe at 6 or 7 in the morning. So then, of course, for afternoon, it's starting to wear off, or if they have to go to after school programming, or if they have sports or some kind of other activity where they still need to be focused, they may need to have that at school. For the Licks dexamphetamine, which is Vyvanse, that's a newer formulation um, that came out maybe I think in the last 10 years or so. Um, what's nice about this one is that it does not, it is, you cannot, the body cannot utilize it until it is actually has been ingested and is entering the bloodstream. So diversion is harder with this Vyvanse. So it's a nice formulation to give to teenagers who may have friends who want to divert, or even for the parents who usually are, unfortunately, the largest diverters of the medication. And it's also good for patients that have had a previous issue with drug use. And then they would, if they still needed to have their medication for their ADHD after they're clean and sober, then you would um, could consider Vyvanse if needed. With the methylphenidates and the dexmethylphenidates, these two are nearly identical in structure and action. Um, the pharmacology is also similar to that of the amphetamine and dextroamphetamine products. Um, the major difference really between the two is that, and this isn't something you need to know for your test, but one helps the medication actually release the um, into the system from the vesicles that create it. The other help, it's kind of works on a pump system that helps to pump it out. So they do really the same thing. It's just a little bit different way that they get the amphetamine product from um, from being made in the brain to um, the chemical reaction site. So with your methylphenidates, again, they're used for um, now getting away from the ADHD meds. We also use the stimulants, as mentioned earlier, for narcolepsy. So one of the most commonly used meds for that would be your modafinil, or Provigil would be the common trade name. So what it does is promotes wakefulness. It then treats narcolepsy, also treats shift work sleep disorder. That is something that you would see commonly in, say, like Las Vegas, where people work very odd shifts so that they need to make sure they can stay awake for those off shifts that they work. It can also be used for patients that have obstructive sleep apnea or hypoapnea syndrome. Um, the pharmacokinetics for that, it's rapidly absorbed in the GI tract, eliminated by the hepatic metabolism, and the half life is about 15 hours. So, generally, it's prescribed once to twice a day. Many times it is given twice a day. What are some adverse reactions with these medications? You can have headaches, nausea, nervousness, because these are stimulants, diarrhea, rhinitis. Um, for drug interactions, you have to be careful if the patient's taking oral contraceptives, so that would, of course, be with the adolescent or the adult patient, and if they're on cyclosporins. Well, what happens if you need drug therapy that is a non stimulant? And this is also a common problem because some parents don't want the children on a stimulant. Some um, children don't do well on a stimulant. It can make them more irritable, or they don't sleep. Or one of the big things we have to watch, especially when the kids are on a stimulant for their ADHD, is that it takes their appetite away so that they don't want to eat. And so if their weight drops too much, then we definitely have to consider an alternative. There is some issue with, or can be with, the growth, but as soon as they stop the medication, that usually reverses itself. And that's a lot of kids sometimes don't take it in the summer, so that they tend to catch up on their height, and many times also on their weight, because then they'll have an appetite to eat breakfast and lunch more than they do when they're in school. So also you would have the situation where an adult has a zero tolerance job where they cannot be on a stimulant if they've drug tested periodically, randomly. Some jobs don't care whether it's prescribed or not. They don't want any controlled substance in the in the person's system. So if that is the case, then we do have a medication um, that can be effective, not as effective probably as a stimulant, but atomoxetine can be used. It is a non-stimulant. There is no potential for abuse, and it's administered once a day. It is actually an SNRI type of product. Um, it peaks in the body in 1 to 3 hours, and it is metabolized by the liver. Side effects with atomoxetine can include GI, a reduced appetite, dizziness, somnolence, so it makes them sleepy instead of keeping them up like the ADHD meds can. And then there can be mood swings and trouble sleeping. So many of the side effects are similar to what you would get with the stimulant, actually, except the somnolence. You do have to worry about drug interactions with MAOIs. It interacts with the 2D6. So you would watch for paroxetine, which is Paxil, fluoxetine, which is Prozac, and quinidine. It definitely has a role in ADHD therapy, and the dosing and administration is based on the weights, either below 70 kilos or over 70 kilos. There are also other meds that can be used to really more of as an adjunctive to the stimulant, or say atomoxetine. They really don't play a role in first line, because uh, the first one that's shown here, the the guanfacine, does not work on the issues of focus and attention. Those are the main roles of the stimulant. It helps the child focus in and attend to their work or their teacher. The guanfacine basically is used to help with those hyperactive um, aspects of ADHD. So, not the attention and focus, which is really the biggest problem. That's what um, keeps the kids from getting their schoolwork done and being successful and possibly being held back. This medication and the next one really help the child to sit still and um, not poke at their neighbor or raise their hand so much. So they're good for those other uh, aspects. So if a parent asks if they should just do these, usually they're not going to take care of the issues with staying on task with, getting homework done, reading the material, having the attention span to complete assignments or do all the reading that's required. So what these do is that they activate the presynaptic alpha 2 adrenergic receptors in the brain. So really what they are is, they're alpha 2 drugs, which because of that, the principal side effects would be somnolence. So it can make them sleepy, there can be fatigue, and reduced blood pressure. So these meds are best given at night. If if at all necessary, you may have to give a daytime dose, but you would always want to start this at nighttime. I always tell the teenagers to make sure that um, they get up slowly, not to jump up off of the couch or the bed because their blood pressure may drop quickly. The other medication that's similar to um, the guanfacine, and guanfacine, to go back, has another name, Intunif. The guanfacine's been on the market for a long time, and that one typically is given uh, several times a day, maybe 2, 3 times a day. Um, the Intuitive is can be given once or twice a day. It's a longer acting formulation. Now on to the clonidine. It's also an alpha 2 agonist. Clonidine has a lot of different uses. It's a very old med, but it also helps with those hyperactive aspects of ADHD. So it would have the same side effects as the guanfacine, certainly the somnolence, fatigue, and hypotension. So the same recommendations for use on these medications. There are other medications that can be used to help with children with ADHD. These would be considered, third line usually in the treatment. So you could use disipramine, mepramine, and bupropion. Now, the tricyclic antidepressants, the first two, help to decrease hyperactivity, but they have little effect on the impulsivity and the inattention um, that can come. So, again, they would be considered uh, more in line with how with the Intuitive or with the guanfacine and clonidine work. Here it says they're second line, but many other resources will say you can say second or third line. Never would they be first line. But if you have a parent that is, uh, staunchly against using a stimulant, then you can certainly give these a try. Of course, with the tricyclics, you definitely got to be careful that you're dosing it correctly, not to overdose, and that these aren't left around for anyone to get into. The other one would be bupropion or Wellbutrin. It can help reduce behavioral symptoms, less effective than stimulants. Um, with Wellbutrin, whether you're giving it for this or for depression, you must make sure you have screened the patient for any seizure risk. If they've ever had a seizure, then this med should not be given because it can definitely bring on, it doesn't cause a new onset, never had before seizure. But if the patient already has had seizures of any type, then it could potentially um, produce more seizure activity. The reason Wellbutrin is used is because it works on the dopamine and the norepinephrine in the brain, which is the same neurotransmitters that the stimulants also work with. So that's why there's some belief that it could be effective, but again, never as effective as the stimulants. In adults, um, you have 60% of ADHD cases persist into adulthood. And that is very true. So you have your adults that are, they've lost the hyperactivity usually, and so they keep the inattention and the issues with focus. So they'll have a job, they cannot complete their reports or assignments given. Their work is piling up. They're getting into a lot of trouble on their job because their work performance is poor. Teachers, you can tell a teacher that's ADHD herself, especially if she's not on meds because the class is very disorganized. She's focused on writing on the board and is not paying any attention to the students because she's hyper focused on that one thing for her at the time. But again, she would have a hard time getting papers graded, assignments back to the students. So, again, symptoms: poor concentration, stress intolerance, get very irritable. There can be antisocial behavior, outbursts of anger, impulsivity is a problem, and inability to maintain a routine. So, for the adult patient, many are on the methylphenidate, the Concerta. They certainly also take the Adderall XR, the extended release combination amphetamine products. We steer away from immediate release medications in either class because those have a higher potential for abuse um, or misuse. So we do not like to give adults immediate release. We definitely like to give them a extended release formulation for their ADHD. In my practice, if a adult comes in and says if they've been on medications, I do ask for records. If they have not before, because maybe their parents did not want to uh, put them on medications when they were young, I still do recommend testing um, to make sure that it is truly ADHD. There is testing um, formats for adult patients up as opposed to those that we do for the children. So those can be done by a psychologist if need be. So now on to the test questions or the questions. The nurse instructs a patient about the administration schedule for Adderall to treat a child's ADHD. They determine that teaching is successful if the parent makes which statement? The drug should be given in the morning before school. You will ask the school nurse to administer at lunch. Best time to give is at bedtime, and it should be given 1 hour after a meal. So the answer here is A. You should be given in the morning before school. One thing about the amphetamine and products or the methylphenidates, if you don't give them before school and you give them right before the child enters the classroom, it takes about an hour to 2 hours before them to be able to be fully effective. So the child will not get the full effect for their first period in the morning, which can be very disorganized for the child. Question 2: a child takes Adderall XR for ADHD. The nurse should assess the child for which of the side effects? And the answer here is C. I talked earlier, I said that weight loss can be a problem for the child, and that can be a reason we have to take them off of that stimulant. There can be restlessness, and there can be chest pain. For that reason, I typically have an EKG ordered, which is not absolutely necessary. There are, if you're worried about a history of any cardiac disease, there are screenings that you can use to make sure there's no strong family history so that you may want to reconsider your use of a stimulant. Question 3: a child with ADHD has been prescribed Daytrana, which is the patch. When teaching the child's caregiver how to administer the medication, which instructions should the nurse include in teaching? And the answer is C. Remove the patch within 9 hours of application. And that's probably the most important here. The best place probably to put it is on the hip. That way it's not on the arm where the child may have on a short sleeve or no or sleeveless wear and have it inadvertently removed during the day. Um, the redness and itching, if that does occur, that might be an indication that is not going to be the delivery method that you can use in the patch, you may have to reconsider going back to a pill form or maybe even the liquid form. The last question, a nurse teaches a 16-year-old female about Ritalin. Which statement indicates that more teaching is needed? Okay, and the answer is A, um, that she cannot have unlimited numbers of soda. The reason being is because just because it's not a cola doesn't mean that it doesn't contain caffeine, and you don't want to give a lot of extra caffeine when the child is on a stimulant because that could cause palpitations, chest pain, dizziness. Non colas, it could still be in Dr. Pepper. It's going to be in many of the orange sodas. Some of the root beers have caffeine. Mountain Dew certainly has a very high percentage of caffeine, so you do have to be careful. Do you want correct teaching would be that she would know to avoid these in excess, and that she could have decaf, and that she would drink 7 Up or Sprite, which have no caffeine. So the correct answer is A. So that is it for this presentation. Thank you.